Put on. Hi, everybody, and hi, Denise. Welcome, honey.
Hi, Wendy.
So nice to see your beautiful face.
You too. Thank you.
So, thank you for coming on. I think it's really important to have you on. I'm going to explain to everybody what it is that you do. So, Denise Miller is a licensed marriage and family therapist in the New York area. You assess and you treat a range of problems, including diagnosis and mental illnesses. And you specialize in family therapy, and you've been doing it for over 15 years. And what's important in this time is, people are dealing with so many things. And the biggest part of this is the fear, the mental fear, like mentally what's going on. And I know you are busy all the time. I don't think you've ever been busier, right?
Right. Well, I've been busy, like this busy, but I've taken some time off and now I'm back to it. And with all honesty, it's like it's almost like having a full-time schedule.
Yeah.
Yeah.
So you're one of those people who's really essential right now. And I'm just going to jump right in and start asking you some questions. And so, and Miss Tom, what's your advice for handling the anxiety and stress that we're feeling?
Well, first, I just want to say that anxiety on a good day is difficult, right?
Yeah.
So it's even more so during this pandemic. And first, it's really important to keep in mind that anxiety is natural and it's a healthy function for us. So I think people are forgetting that and that it serves a purpose usually, to just kind of keep us alert and keep us away from danger. And so it's really a natural process. And I think it's really important for people to keep that in mind, that it's also something natural to us and we don't have to be so afraid of it.
That's a really good point. That it's normal.
Yeah, it's
So,
normal.
yeah. Okay. So you're getting calls all day long. And I know there's a lot of themes to what you're dealing with. So what worries you the most when it comes to people's mental health during this pandemic?
Well, first, I'm really actually worried about what's going to happen after all of this, right? It's chronic stress and the anxiety that's chronic that worries me about what's going to happen later. So, one of the things that I've been thinking a lot about is um, perhaps there'll be a rise in PTSD,
Yeah.
right? Post traumatic stress.
Yeah.
There'll also be a rise in phobias, which makes sense.
Hmm.
And also depression, of course. So what worries me the most is not only having pre-existing conditions like this, but I feel these specific ones in all the fields across the board, even all our frontliners, especially that are seeing it first and foremost, um, will most likely be suffering from one of those, if not a couple of those that I just mentioned.
Yeah. So what do you suggest then? Like now knowing that, because you're 100% right,
Yeah.
knowing that, like, do you have any suggestions on what they could be doing now to kind of preempt that, or, you know, uh,
Well,
get some tools?
yeah, well, when I'm with my patients on video, um, I've been giving them a lot of suggestions that collectively I see are working. And so even though with every session it's custom to that particular patient and what they're experiencing, because although we're going through the same storm, it's sort of like everyone still has their own story. Some are losing jobs, some aren't, just as an example. So, but collectively, there are a few things that I've come down with that I see are working. So I can go through that if you like.
Yes, please.
Okay. So first I see, and it's one of my favorites, is exercise,
Yeah.
right? Like it's one of my favorites because it really helps you to feel good, right? And it's a really great contributor in our overall health and feeling good, but overall well-being. So exercise, I think, is a really big one. Whether you seek yoga, meditation, walking, running, just maybe holding on to that old routine of working out, that really shouldn't be interrupted if you can hold on to it. I think that would really benefit.
Yeah, very simple, and anyone could do it anywhere. Even, I mean, today's a beautiful day, just a walk outside. So it definitely lifts your spirits and changes the energy. So
Right.
yeah, I totally agree with you.
So the second thing on my list is a healthy nutrition. right? What are we putting into our bodies? So eating a well-balanced meal, trying not to skip any meals. I think a lot of my patients are telling me that they're eating at all random times of the day. And I know it's hard not to do that. But at the same time, I think if you can stick to a routine with your eating, it also helps you stick to a routine, which is great. We'll get to that. But not skipping meals because you need that, right?
Yeah.
Um, I think even energy boosting, like healthy snacks, most of all, keeping in mind is great, just to help us have that energy and
Hmm.
readjusting like that loss of energy. Because while we're stressed and chronically stressed or having anxiety, the body needs more rest and more sleep, right? And so we're going to be feeling more fatigued and tired. And so nutrition and what we're putting into our bodies, I think, is really vital.
Yeah.
On a side note, I want to mention a couple of my patients and friends are telling me that they want to drink wine, have a beer,
Eat
relax.
chocolate.
Right. But like the wine and the beer, especially, which makes a lot of sense because they really want to unwind that way. It might kind of break some of the edge. And
Yeah.
I always just say and keep in mind that if you're not suffering from any anxiety or high stress levels, that's great and fine. And I understand that. But you have to keep in mind that it actually could aggravate the anxiety and trigger panic attacks. So if you are suffering from anxiety, then I would say just stay away from the wine, the alcohol, and even caffeine. It could aggravate our anxiety and throw us into some panic attacks. So just keeping that in mind.
Yeah. That's good. And it's, those are the basics that you're saying. And that's it's just back to the basics.
It's back to the basics, right? But just really kind of holding tight to them right now because they are essentially proving right now, at least from what I'm seeing, to be real tools, like real honest tools that sound so simple, but when you put them into action, they're actually really beneficial.
Yeah, I completely agree. I think a
Yeah,
holistic approach, is so much better. And I do think that
yeah,
people are going to go more and more back into those simple ways.
yeah, yeah.
Definitely.
So I'm going to go down my list. I
Yeah,
have,
keep going.
yeah, I just have another two.
Thank you, honey.
Um, the next one is adequate sleep. A major, something major that I don't think not one patient is not reporting. All of them are reporting that their sleep habits are off and they're not getting adequate sleep and they're going to sleep really late, or when they're trying to get to sleep, they're not able to fall asleep easily at all. Right?
Yeah, I have the same problem.
So the thing yeah, so I've been asking this question and it's interesting the answers that I'm getting. I'm asking them, what are you doing right before you get to bed? Right?
Yeah.
And most of them are saying, well, what do you mean? Like I've put everyone to bed, I've cleaned up the house, I'm all ready for cozying up in my bed. And then I get on my phone and I'm checking out the COVID-19. They said like it's just like the first go-to, which is the COVID-19 update. So we explore that and we always find that um, obviously the answer is going to be it's not beneficial, but how beneficial can that honestly be? In raising up the anxieties, raising up the worrying, your stress levels will go up, your blood pressure will also rise, and your heartbeat will also go faster. So altogether, physically and mentally, it's really not advised to, I wouldn't advise it to be doing anything like that prior to getting to bed. I think that is probably one of the major contributors of them not being able to fall asleep or get to bed at their normal time.
Really important advice. It's because I'm guilty of it too.
Yeah. Okay, so what was that?
I'm guilty of that too. So yeah, that's really important advice. Not to put that in my consciousness before I'm trying to sleep.
Right, right. It was happening to me too early on, but
Yeah.
then as I was listening to my patients and realizing that we're all collectively going through that, I was giving the advice and then I took the advice. So as soon as I implemented it, I realized, okay, I need to just follow it. And to be honest with you, it does work. It's just you have to be really aware and conscious of what you're doing right before bed. And it might take a couple of nights, of, the first night finding that you won't get to bed right away, and
Yeah.
you'll just be sitting there and your thoughts, might get the best of you, but don't introduce anything else. And slowly, I think your mind will soften. I think your mind will go to a better place. And a couple of days in, I think you'll see that it'll be really beneficial.
Yeah.
Okay. And the last one is, I think it's so important for everybody to keep in mind that you really need to stay connected to all your family and friends. I'm finding that this is a great opportunity for me to kind of catch up with everyone because we're always working. We don't really always find that time to catch up. So I'm texting people, I'm messaging, we're messaging each other. I'm catching up. And so I think it's sort of a great time to take up on that opportunity to, connect with people and just catch up with everyone.
Yeah, that's really important to stay, because naturally we as humans we need connection.
Yeah,
So that you're right, it's so important to do that.
right, right.
So another, I mean, as a mom, and I know a lot of people who are going to be watching this, we're concerned about our kids.
Hmm.
I have teenage daughters, this is really impacting them a lot.
Hmm.
So what advice would you give to parents in, supporting their kids with everything that's going on around them?
Right. Okay. So I think what I would say the best way to answer that is it's really okay to talk to them about how they feel about what's going on. I think there might be some reluctance with some parents I'm hearing in what do I do? Do I share with them what's going on? When they ask a question of what's happening, why has so much changed? They're really unsure and confused. There's this line that they don't know if they can cross it or not, or they should cross it. And so the best advice I can give to that is absolutely have a conversation with them about it. Um, ask them, if they have any questions, let them share with you how they're feeling about it, if they're having any thoughts about it. Most of all, listening.
Yeah.
It's really important. I've been doing it with my little one, and to be honest with you, there was a lot of confusion. I mean, he's only 5, but there were a lot of questions. Why everything's changed so drastically, so suddenly, and having those conversations not once, but regularly. I'm just keeping that line of communication open and not sharing too much. That's not appropriate. Of course, you have to consider the age of the child or the teenager, but it's really reducing his fear, I think, and worry about all of this or confusion for sure.
Yeah, and you're right. It is definitely based on like their age, and so that brings me to this. A lot of people are, losing family members, or people are getting sick, or family, friends, parents are getting sick with COVID. And
Mhm.
like, how honest are you? Do you recommend that we are with our kids, about the people that are getting sick?
I think that it's really important that our language is considered when we're talking to young children. But if there is someone in the family that we've lost, it's just like before all of this, right? It's what have you set up or agreed as a couple or decided as a mom or dad that how do you discuss, for instance, death? How do you explore that or explain it to a young child? And so I think the language that you've already created, either in your own mind and or the dialogue with your child already pre-existing to this, I think that you can utilize that going forward with sharing the important information, like if a grandparent or a family member has passed on. So I think sharing it is really important, but I think the language and how you're going to discuss it is actually where I'd focus most on.
So that's yeah, okay. So that's a good point. To like, predetermine. Look, if this happens, this is how we're going to handle it as a family, as a
Right.
parent. That's important. And then, you know, people are losing family members, and this is such a weird time because you can't grieve somebody like you used to. There's such grief. I know fear is a big theme in this, but so is grief. You know, the grief of losing your life as it is. I mean, your lifestyle, the grief
Right.
of losing your job, the grief of losing your, a family member. So, like how, what would you
Well, there,
recommend people do?
well, there's so much grief going on right now because if you really think about it, we're all experiencing such a loss of normalcy,
Mhm.
right? The day-to-day grind, the day-to-day mundane. I mean, it's realistically right now it's at a halt, and so I think um, what what I would actually tell everyone to do is, as much as they possibly can, is staying really connected to their family, spending time coming up with different ways, activities with children, coming up with fun activities to keep them busy. Adults, I'm hearing a lot of between work and home. In the very beginning of this happening, it was a little bit easier, obviously, because staying home, it was almost like a vacation. I get to just be home. And now I could spend the next couple of weeks distracted a bit on how do I set up work from home, or the excitement of it, of just having to do nothing and wind down. So I think after a certain amount of time, people just really felt a little bored and had exhausted so much of the things that they started doing that were fun and exciting. And at some point, they reach a point, what do I do next? So I always, and with everyone, I've really seen a lot of progress and improvement when I've advised them to just recreate, or create, because like we said, the home and the work is blurring, or it has by now.
Mhm.
So recreating a routine and recreating like a schedule. And keep in mind, kids especially, they really need that. They need structure, they need routine, they love that. So it'll benefit the kids if you have kids, but as an adult as well, I think staying really close to that idea, and not allowing yourself to not have a routine of any sort, I don't think would benefit us. We need some type of differentiation from one activity from the other, as we did prior to the COVID. So it's just internally creating that routine and schedule and allowing us to somewhat feel some type of predictability. Because what we had prior was a real sense of predictability in some way as far as our lives went on a daily basis. So establishing some predictability with routine and scheduling.
That makes sense. It's kind of like a sense of control, because that's also another theme, is that we are kind of out of control right now.
Yeah. Yeah.
So
Everyone
having,
feels like, how do I escape from this? Right. I can't have
yeah,
a sense of control. Right.
but creating these, like you're saying, these structures, these difficult conversations, these schedules, and decisions that you would make. If this happens, let's do this. Then I think that is a way of keeping some sense of normalcy and control.
Right. Right.
So yeah, it makes sense what you're saying. Um,
Yeah.
and then, honey, is there anything else, like personal, you'd like to share with us about this time for you?
There is one thing.
Yeah.
I've been feeling kind of like guilty, um, and feeling bad that while I'm home working, and I think a lot of parents will understand this. This will, it's being home, having to work, and feeling bad that my 5-year-old, if I'm home alone with him, has to kind of entertain himself. And so I've been talking a lot to my patients about, we're talking um, about being compassionate to one another and being there for one another. But I'm finding I caught myself a couple of weeks ago that I wasn't actually being compassionate with myself. And it's okay that I can't be that perfect parent right now, or ideally, of whatever that would be. So like, I'd rather be sitting and being able to stimulate him and play with him, and do the things that we normally would do. That would be, seeing that smile on his face, because it was from one activity to the next. And now I feel once we're done with homework and I'm getting on the computer to speak to patients, he has to then kind of entertain himself with whatever I set up for him to do. And that's something that I've been, working on, which is have some compassion for yourself, Denise. It's okay. This is how it is right now. And I'm also actually talking to him about that, to make him understand that this is, a big change for you, but it's also a big change for mommy and daddy. And this is, and like slowly he's, really, it's great. Like he's understanding it and he's getting into the, adapting, and it's been okay, but I still feel bad. So I would say that if anyone is feeling that way, it's okay to feel that way. And there's really no way to really change that right now other than just changing it with how we feel about it.
Yeah, that's true because but what I love about what you're saying is just communicating, no matter how old your child is or who's in your house with you, is just communicating, because so many issues are coming up. We're all working through our stuff, so that's what you're dealing with, is the guilt of not spending the time with him, and you communicating it with him. I love it because you bring him into the conversation, and maybe you'll hear something, like you said, listen to them. Maybe you'll hear something that's like, okay, good idea. Let's do this differently, and that was with any conversation.
Like he's only 5, and I'm going to give you an example. We went out to my parents' beach house out on the North Fork for a couple of days, just for a weekend to get away. And on the ride back, it was a great weekend because, we just got to just be out where it's more quiet and relaxing by the beach. And then here we are just heading back home, a 5-year-old saying, that was great. I had such a great time this weekend. I said, that's great. That's beautiful. And he says, I didn't think about this whole coronavirus not once this whole weekend.
Wow.
And I don't have the news on. I have a rule. I put on for 30 minutes every morning prior to him waking up, to just be abreast of what's going on, and and having like that update from myself. But I close it. I don't expose him to it. If I'm speaking to someone, I go into another room, or I speak another language, so he won't understand it. And and we know that kids, no matter what, they're understanding. They're gonna understand it. You know they're part of it too. So it was just interesting to me.
Important, because out of the mouth of babes, like he was right. You probably had the best time because your consciousness was not consumed with coronavirus.
Right. But it was almost sad in a sense to hear a 5-year-old talk about it that way. And
Yeah.
so again, that was an opportunity for us as parents to have that, like you said, communication, like that conversation. And I think if it's fluid and it's not something to be afraid of discussing with with your children, sort of it lessens, reduces the anxiety that surrounds the whole situation in itself. That's what I've learned as a parent, as the more we allow it to be a discussion, if it naturally
Yeah.
gets introduced into the conversation, that fighting it or being so afraid of it, I think raises the anxiety surrounding it. So allowing it to be fluid and having those conversations easily with one another and the children, I think just is healthier.
Exactly right, Denise. Thank you so much, for your time and for the service that you're doing for all these people. They're lucky that they have you. And I'm going to put your contact information in the bottom of this video. If somebody wants to reach out, this is something that you specialize in with families and individuals, and it's a really hard time. And the most important is that people reach out for help, because there is somebody like you who does that.
Right. And if it's not me or a therapist, a psychologist, a psychiatrist, I always tell everyone, just don't stay in your house feeling stuck and allowing this whole situation to make you feel frozen and that you can't go outside of your house. Like, remind yourself that a simple walk, a run, walk around your block, some fresh air, even just going to the beach, seeing the ocean, that's really relaxing, doing even a meditation or putting on meditative sound, calming music. I mean, really understanding that introducing certain things does break up this feeling of stuck. And the feeling of feeling stuck is actually not a good thing because it can manifest into so many different things, right? Like we discussed.
Yeah.
So when you're feeling stuck, keep in mind that you don't have to be locked into your house. You do have options, although with limitations, doing everything safely with a distance, of course, socially distancing and all of that, of course, abiding by that because it's going to benefit everyone. But at the same time, the limits are not that limited. There are still opportunities and things that you can do just around your house or on your property or in your neighborhood that could still just make you feel better psychologically and restoring that sense of, like I said earlier, predictability or normalcy to a certain degree. And control, like you said, control is a really big factor when it comes to anxiety.
Yeah, well, thank you, Denise. Thank you for your time, honey. And you
Thank
stay
you.
safe, and
Too.
hopefully we'll be able to see each other in real life soon.
I can't wait to come to the cave.
Me
I
neither.
am so excited. I can't wait.
Thank
Thank
you,
you.
honey.
Thank you. And
Goodbye.
be well. Stay safe for everyone.
Thank you, honey.